this topic. Thank you very much.
Break your mind.
Please, over to you.
All right. Good morning once again, REMS Nation. This is it's been a powerful period so far. Event started from last week for our anniversary. We had a visit to the orphanage home last week. We had so many events last week. And today, the welfare department is with partnership with the training department, bringing you this health talk just to ensure that we have interest in our members' health and our life, wanting to make money and enjoy the money for good things, not for treatment, not for trying to make your life, trying to pay bills to heal yourself from things that you have avoided early. So REMS is it's an holistic family that has interest in also your well-being and your health being. All right. Okay. So if I'm correct, is the right word to say that. So without wasting much of our time, after this section, we're going to acknowledge more of our leaders on the call. But right now, I want to just hand over the platform to our Dr. Precious. Before then, I don't know if you have a word to say about the doctor, Ife Dolapo. You want to introduce our doctor to us very, very well?
Good morning, everyone. My name is Ife Dolapo from Ija HMO. I'm the RM for REMS, and on call also is Dr. Precious, who will be handling the health awareness. As you all know, the topic is cancer. So, Dr. Precious, please, over to you.
Right.
All right. Good morning, everyone.
Morning, sir.
Yeah, it's good to be here today. Once again, I want to appreciate the organization for giving us the opportunity to come and impart knowledge. And like we've heard from our dear pastor, I mean, Coach Bobby, is just the anointing is reflecting in your voice. Every single statement, it just shows that you are from the pulpit, but it's fine. So if you have questions, if you have concern, at the end of the session, you will ask them. So I'll just share my screen briefly while we... So just to confirm, can everyone see my screen, please?
Yes, I can see your screen. Yes, sir.
All right. So yeah, once again, today we're going to be talking about cancer awareness. And why this topic is important is simply because when we hear the word cancer, what comes to mind is an incurable disease or incurable diseases that is scary and deadly. And most part is because we don't have enough information going around when it comes to cancer. Again, so cancer is not altogether, the worst disease in the world right now, because we have some preventable types of cancer, as well as we can also treat some type of cancer, especially when we get to diagnose these cancers early, right? Because again, early detection is very, very important when it comes to managing cancer. And that is why we're going to be advocating on ways we can prevent, ways we can detect this condition early, and possible treatment for cancer. So yeah, well, our objectives today will be to define cancer. We'll look at the common cancers in Nigeria, their treatments, and of course, the ways to prevent some type of cancer that are usually preventable. So what is cancer? By way of introduction, cancer is a very serious condition. It's a public health problem worldwide, affecting millions of people around the world, and it affects all categories of persons. So whether you're Black, whether you're white, whether you're young, whether you're old, depending on your geographical, region, your ethnicity, it affects everyone. However, there are some types of cancer that may be predominant in certain race. For example, as a Black person, there are more types of cancer that could be, more prevalent in certain race as compared to the other race. So it is the second common cause of death in developed countries, and cancer is simply an over-proliferation of cells in the body. So let me explain. Your body is made up of cells, the very functional unit of life, very, very minute. However, when cells come together, start functioning, they make up what we call tissue. Example of tissue is your muscle. Then when tissues work together in harmony, they make up what we call an organ. For example, a liver is an organ, your skin is an organ. And when organs work in harmony, basically performing a similar function, they make up of what we call system. So for example, we have digestive system, we have respiratory system. Respiratory system includes your lungs, your larynx, from your mouth down the way to your lungs. So that's how it is. But for some reason, the tiny, cells, they tend to overproduce more than necessary. So let's say you have a cut. When you have a cut, the healing process starts immediately. So there's some movement of certain types of blood cells going to those regions as signaled by some chemicals, right? And they will be clotting gradually. Fibrin will be formed. As for some reason, there will be inflammation. All of these things is just to ensure that there is proper healing. When this cells starts to break down, before healing happens, those cells will start to break down. We call it mitosis or meiosis. When it start to break down to close together, or what we call apposition. So when these cells meet at a particular point in the healing process, there's a signal in the cells or in the healing process to say, oh, okay, fine, we've reached our bus stop. So to speak, let's stop producing, let's stop dividing, right? And then there will be scar tissue, there will be healing, and of course, oftentimes the end of the healing process. But for some reason, these cells, they don't stop dividing or proliferating. And that can also be, that's just a way to define cancer. And so uncontrollable proliferation or production of cells is what cancer is. So we're going to be looking at 5 most common cancers in Nigeria. And like I said earlier, cancer is not always deadly. There are some types of preventable cancer, and we're going to be talking about them today. Because a lot of persons just feel like when the word cancer comes, usually they are idiopathic, they don't have specific causes, but some type of cancer has risk factors. And the more we know all of these things, the more we can prevent, the more we know how to manage ourselves, the more we can detect early. And like I mentioned earlier, early detection is key to surviving any form of cancer. So we're going to be looking at breast cancer, cervical cancer. Of course, we're not leaving the maize behind. We're going to be talking about prostate cancer, colorectal cancer, which is the cancer of the colon, and of course, liver cancer, which can occur in both gender. So just to confirm, can everyone see me, please?
Yes.
All right. So what is breast cancer, right? Breast cancer is again, overproliferation, for some reason, lump or cancerous cells growing in the breast. It is the commonest type of commonest cancer, female cancer. However, it is very funny to say that 1% of breast cancer can also occur in men. Yes, a man can have breast cancer. Yes, but again, it's like 0.5 to 1%. So it's mostly common in female. So how are men predisposed to it? Men who are probably, they have what we call gynecomastia, they have increased fats in the breast, maybe predisposing factor, they have a family history of breast cancer, and many other factors, smoking, alcohol, they can also predispose a man to have a breast cancer. So there has been increasing the frequency of this condition, moving from number 2 or 3 to the number 1 cancer. And we're seeing that the trend is increasing every day. So why are we very concerned about breast cancer is that we can actually detect any structural changes in the breast on time. So as a woman, right, there's something called breast self-examination, right? So it's something you should do, within a time period of your menstrual cycle. So before we go into that, majority of breast cancer occurs in women in their reproductive years, at the peak age of 50. So it could be less than that. And the signs and symptoms include, for some reason, you can be feeling this pain lump in the breast. So a very immovable, solid, mass in the breast, and sometimes there could be retraction of the nipple. The nipple goes inward, or a dimpling, or call it, let's say, for those that are driving, if you have a dent in your car, that inward protrusion can be an example that something is wrong. Or there could be discharges, redness, skin changes, the texture of the breast. So how do we sort of prevent or early detect any changes in the breast? It's two things. One, it is done by breast self-examination. It's a self procedure that can be done by a woman 3 to 5 days after your period ends, right? Because at that point in time, the breast is less dense and it's easier to feel any changes at that point in time. So you do it by standing in front of the mirror, and of course by palpation as well. So you are looking at the breast and of course using your hand to observe for any changes. So as a woman, you stand in front of the mirror, which is with your hands on your side, and of course you are looking if there's any structural changes. What are you looking for? You're looking for any change in coloration, looking for any change in size. If it's overly bigger than the other, that can be a problem. So you lean forward, putting your both hand on your waist, and to check for any structural changes, like I mentioned earlier. Then the next is palpation. So now you are going to lie on the flat surface with a flat towel underneath the shoulder of the breast you want to examine. So with the opposite hand, you palpate all 4 quadrants just to check for any presence of lumps, discharges, pain, all the way to the armpit, because sometimes they can be increase or inflammation of the lymph nodes. So these are just ways to check. And any changes you notice, don't be scared, because 9 out of 10 breast lump are benign. So let me say that again. They are not cancerous, 9 out of 10. So factors that can also help lower the risk of breast cancer is, healthy weight. Of course, for those who are overweight or obese, it's very important that you start working out on that. No smoking, because smoking can also be a risk factor for breast cancer. Inactivity can also increase the chance of having breast cancer. So physical exercise is very important. And of course, zero alcohol use. I mentioned some risk factors, just a way to continue them. Being a female gender is a number 1 risk factor, because like I mentioned, 1% is only for male. And of course, the older you are, the higher your chances of developing breast cancer. Sometimes relative, if you have a family history of breast cancer or abnormal genes, we call it BRCA or BRCA1 and 2 gene, or you've not had, first pregnancy or late age at pregnancy, so you are giving birth, you are being pregnant later in life, late pregnancy can also be a risk factor. An increased dietary fat, alcohol intake, smoking, I've mentioned all of those things earlier, or a previous history of breast cancer in that person. So these are basically the risk factors of breast cancer. So we'll move to cervical cancer. Cervical cancer is basically the second most common cancer in Nigerian women and most common female gender cancer. So basically, we're also seeing a second leading, cancer mortality rate, and age range between 17 to 80 years, with peak in the 50th decade. Again, middle age is usually the age at which most cancer are more prevalent. That's in the age of 40 to 50. And is basically cervical cancer is basically overgrowth or a tumor in the cervix. So the cervix is the entrance to the womb, right? So, or we'll call it the uterus. So for some reason, there are structural changes, the epithelia or the cells overgrows, and there's tumor in that, region of the reproductive organ of the female. But the good news is you can actually detect cervical cancer early. It can be prevented. And of course, the prognosis can be good, because we realize that most causes of cervical cancer is attributed to the HPV, which is the human papilloma virus. And the symptoms, they vary. But the issue is that most symptoms of cervical cancer, they don't present themselves until later stage. So most people don't even have symptoms unless they usually go for pap smear. Let's say you go for you go to your pap smear done. Pap smear is basically to check for any structural changes in the cervix. So it's recommended to get your pap smear done once every 3 years for women in their reproductive years. And if you've hit menopause, it's once every 5 years. So, but when symptoms do occur, like I said, they don't occur on time until later on. That is why pap smear is important. There will be bleeding between periods or after sex. There is vaginal discharge, discomfort basically change in the secretion and the sensation you feel. You just feel something is wrong in the cervix, and it's heavy bleeding and all of those things. Again, there are other conditions that could also present with the same symptoms. So that is why you should not self-diagnose yourself. You need to talk to a doctor and ensure you get proper, screening. So if your pap smear is negative, and sometimes we still realize that most women, even when they go for their pap smear done, they still feel symptoms. There's still heavy bleeding, there's pain, there's all of those changes, discomfort, and you still need to talk to a gynecologist, because sometimes there may be other reasons why you are coming down with a sign or a symptom. So just to confirm, can everyone still hear me, please?
Loud and clear.
All right.
Yep.
So how do we prevent cervical cancer? So you may reduce your risk by, of course, be safe, play safe, of course, because HPV is transmitted through blood and body fluid, basically. And the use of condoms is important for those who are married or married. And of course, it's good to just reduce your risk. Multiple sexual partners is also very important to could reduce that. Delay first intercourse, because usually early menarche, or let's just say early sexual intercourse, exposes individuals to HPV. So for those who have kids, these are things we should talk to them about. And of course, avoid smoking. Yes, smoking is not just bad, it's not just horrible for your heart, for your other organs, your lungs. It can also affect your cellular structure. As a matter of fact, smoking is a number one risk factor for bladder cancer. So it's important that we quit smoking. And the good part about this condition, this type of cancer, is it can be protected by taking the vaccine. There's HPV vaccine, which is the human papilloma virus vaccine that can prevent you from the deadly strain of the HPV. So we have different strain. Usually, most of them are harmless. So people have HPV, they just come down with genital warts. Some persons don't even have symptoms. However, a few of these strain can change the structure of the cervix, causing cervical cancer. Again, remember to get tested and get regular pap smear done. So we'll move to the male organ, right? Or just this is for the men now. Prostate cancer is the most common cancer in Nigerian men, and the infection is increasing over time. And why is this so? Because of the introduction of the prostate-specific antigen test. So if you are listening to me right now, from 40 years and above, you should be going for your PSA screening test once every year. So the prostate-specific antigen test is to check for any changes or other changes. It should not be more than 4.0 micromils of blood, right? So there's a number, there's a range, 0 to 4. So, however, if it is more than that, the doctor will have to order more tests to be done. And lastly, the most diagnostic technique to check for any prostate disease or any prostate condition is biopsy. So a structure of the cervix, of the prostate is taken to the lab and to check for any presence of any cancerous cells. So there are also other methods as well. There's digital rectal exam, where the doctor will check through the rectum for any structural changes in the prostate. However, there are basically other conditions that can affect your prostate that will also present with the same symptoms. So let's look at some risk factors and some signs and symptoms. So your risk factors, like I mentioned earlier, most cancer, they don't have specific causes, but we have genetic factor. Let's say a grandfather had it in the past. Chances are that it could be transmitted into the next generation. So patient presents race as a Black person, African American, or African person, increases the higher chance of having prostate cancer. Age above 40 years, positive family history, and if you're obese, for men who have increased belly fat, your body mass index is above 30 kilogram per meter square, it means that you are having an increased chance of having issues with your prostate. So we'll look at the signs and symptoms. So if you have any issues with prostate, two things is going to happen. As you age, there can be a natural enlargement of the prostate gland, right? It's that gland responsible for secretion of the semen that carries the sperm during ejaculation. So it's a very important gland. And the natural increase or the inflammation of that gland, it can lead to constriction of the tube that you urinate from. We call it the urethra. So for some reason, you're going to present with certain signs and certain symptoms, right? So there's something called benign prostatic hyperplasia, or we call it BPH. It is not cancerous. It is just a non-cancerous inflammation of the prostate. However, it presents with almost the same symptoms as someone who has prostate cancer. So number one, there'll be interruption in the urinary stream. You're urinating, and for some reason, there's interruptions. And there could be frequency urination. You want to urinate all the time, especially at night. Again, there are other conditions that could also cause you to urinate at night, especially when you have sugar problem or diabetes. Then there's hesitation before beginning to urinate. So you have to put your hand over the toilet seat just to increase pressure on the pelvic muscle to start urinating. The feeling that you did not empty your bladder completely can also be a symptom. Then it could be terminal dribbling. So after urinating, you will have to wiggle your organ just to ensure that the urine stop dribbling. But so it can also be a sign that something is wrong with your prostate. And urgency to urinate, and most importantly, weak urinary stream. So while we were younger as men, it's easier for us to write our name on the floor with the force when we urinate. You can even spell Nigeria, whatever it is. But as you grow older, the stream, the force reduces over time. However, if it starts reduced that drastically to the point where before you even start urinating, you're already swelling yourself, that can be a sign that something is wrong. So we have different types, of treatment options when it comes to prostate cancer. But most importantly, your doctor or your oncologist would want to employ what we call watchful waiting. So it means that let's not wake the sleepy dog. Let's not go there and do any surgical intervention. Let's just watch and see, because some persons are very lucky that they have the non-aggressive form of prostate cancer. So you just go for checkup every now and then. Some persons have prostate disease and they live for the rest of their life without requiring surgery. They just go for, checkup, right? It's important. Because if there's a gradual growth every year, so it's the best actually. However, some persons can have the aggressive form of prostate cancer, so which necessitates surgery or surgical intervention, and of course the prostate will be removed, and in conjunction with the different types of therapy, which is chemotherapy, radiation therapy, all of those therapy rays that just want to, the purpose is to destroy the cancerous cells. So it's either the radioactive substance or seed are implanted in the prostate gland to destroy it from within, or an external beam of light of rays is sent to destroy these cancerous cells. So these are just basically the treatment option for prostate disease. So just to confirm, can everyone see me, please? Can everyone see me, please? Just to confirm.
Yes, I can.
All right. All right. So the next is colorectal cancer. Why is this important? Because we're seeing an increase in this condition among older adults. So it's basically a very commonest cancer of the gastrointestinal tract, basically from your mouth down the way to your large intestine. So it's just a colon, meaning the intestine, right? Large intestine. And of course, rare disease in Nigeria peak at the age of 60 to 70, usually again, mid-age 50, 0.7 years. That's when it's mostly common. And the crazy thing about this colorectal cancer is that it occurs more in males than in females. So the polyps, there are some non-cancerous growths or small growths of tissue in the large intestine. So for some reason, these polyps can turn into cancer. So if it can turn into cancerous cells, and for some reasons, this person can come down with colorectal cancer. So we have different signs and symptoms. So if you are older adults from your 45, 50, it's advisable to have your colonoscopy done. It's a camera going through the colon to check the integrity of the colon. It's very important. It's part of medical screening, because in this part of the world, we don't prioritize preventive healthcare screening. You don't go to the hospital only when you are sick. As a matter of fact, most disease conditions don't present themselves until there are complications. For example, high blood pressure. If you have high blood pressure, it's a silent killer. Some persons may even come down with a stroke, before they go to the hospital. Some persons have a blood pressure of 170 over 110 without having a single symptom, and they are moving about, only for them to collapse in the party. And most times, it's very easy for us to attribute it to, diabolical, causes or spiritual problem, which also has its own place. But as a medical practitioner, we believe that sometimes or most times people don't go for checkup until they have complications. So if you have changes in bowel habits, there's excessive diarrhea, constipation, especially if you are older, rectal bleeding, blood in your stool, abdominal discomfort, you're always having cramps, gas or pain, or basically a feeling that the bladder, you didn't empty the bowel, completely after you use the restroom, or weakness and fatigue, or unexplained weight loss. So these are some of the basic signs that could occur when the colorectal cancer starts. Then lifestyle factors that can increase your risk as well. For example, if you're not exercising properly, right? If you don't exercise, your food, you're not allowing the food in your body to properly digest. That is why when you eat late at night, or when you wake up, you will probably have bloated stomach, start having increased belly fat, and of course, indigestion can come in as well. So it's important that we, if we inculcate regular exercise, low fruit vegetable intake can also increase your risk, because now you don't have enough fiber, or you don't have enough fiber in your food. So low fiber, high fat diet, being overweight, excessive alcohol consumption, and tobacco use, these are some of the risk factors. So that is why we always advocate stop smoking, cut down on alcohol. And of course, sometimes people have inflammatory bowel diseases, or maybe you're having history of family of colorectal cancer, any type of polyps at all in the family. So all of these things can increase the risk of developing colorectal cancer. So it's very important to go for regular colon screening. Like I said, colonoscopy from the age of 50, at least once every few years. It's very, very important, because when you do that, you are going to detect any changes on time. And when it comes to cancer, early detection is key to having a good prognosis. So major predisposing factor, I mentioned that earlier: low content on absorbable vegetable fiber, high content of refined carbohydrates. So as you grow older, you need to cut down on, excessive carb and refined fats. So high fat content, low intake of protective micro nutrients. So all of these can increase, your chances of developing colorectal cancer. So that's why it's very important from the age of, 50 and above, we should take care of ourselves properly. So for liver cancer, where I begin to round up, liver cancer is the most common cancer death in Nigeria. Because why are we saying that? Because we are seeing there are many reasons, there are many causes of liver cancer, right? And again, it is the most common cause of liver disease in Nigeria. We have basically four stages of liver cancer. So stage 1 is when the tumor is small, and of course it's confined to one part of the liver. Yes. So when someone develops a cancer of the liver, it's confined to one part. Then stage 2 is that these tumors, a few of them, they've spread to nearby blood vessels. So in stage 1 or 2, the prognosis or the outcome is usually good, because it's still very confined. Either you're doing surgical intervention, chemotherapy, or any form of radiation. But in stage 3, this tumor, they've moved from the liver region to the stomach, to the blood vessels, to lymph nodes. So we'll call it metastasis. So it means the cancerous cells, they move from the region to other parts of the body. And so it does, again, stage 4 is just the last stage. So our goal is that cancer conditions should be reported and detected within the first, 1 and 2 stages, so that it's best, treated and managed at that point in time. So what are the major causes of hepatocellular cancer? Yes, chronic hepatitis B and C virus infection. If you're the male gender, chronic alcohol abuse, because we have what we call alcohol-induced liver disease. So we call it fatty liver, or cirrhosis of the liver because of too much alcohol intake. So I once had a patient who died, who passed on because of liver condition. It's very important to note that when you take too much alcohol intake, over time, right? The changes may not happen now. Your liver cells break down alcohol. You could call it alcohol metabolism. For every time your liver works like that, the cells, some of the cells, we call it hepatocytes, they die, right? But the good thing about the liver is that it has the ability to regenerate itself. But for some reason, if the rate at which you consume alcohol, it's more than the rate at which the liver, sort of regenerates itself, then they could start having fats in the liver, fatty liver. You start having scar tissues, or you start having cirrhosis or liver death. So the cells can actually, die. And like I mentioned earlier, there are different causes of liver cancer. So if you have hepatitis B, chronic, hepatitis C, chronic, cirrhosis, which is a liver death, or excessive drug use, some drug that are even prescribed or over-the-counter drugs like acetaminophen, too much abuse of NSAIDs, non-steroidal inflammatory drugs like, acetaminophen, diclofenac, all those drugs, paracetamol, if you abuse it so much, it can also affect liver over time. So it's good to get prescription before you just go about getting medication. Alcohol can be a cause. Smoking can also be a cause of liver cancer, and diabetes, uncontrolled or improperly managed diabetes, can also affect the liver. But the good things about liver cancer is that some type or some causes can be prevented. So I'll get to that briefly in a session. So we'll just highlight some things about cancer while we begin to, round up. Cancer and breast cancers are consistently leading, and breast cancer have taken over cervical cancer, although both of them are increasing over time. And of course, breast cancer is also common in both gender. Again, mostly in female, compared to men. Colorectal cancer and liver cancer, major emerging threats to Nigeria population. And this is because people have refined fat diets, they don't exercise, and all of those changes, all those risk factors that I mentioned earlier. And hepatitis B virus, with emerging hepatitis C virus, it explains the reason why we're having increase in liver cancer situation or condition, because these virus can be transmitted through blood and body fluid. So if you have unprotected sex, or maybe you are sharing needles, or you have sharing sharp objects, body fluid basically can transmit hepatitis B and C. So just to confirm, can everyone still hear me, please?
Yes, sir. Yes, sir.
All right. Prevention. At least 1/3 of all cancer cases are preventable. Prevention offers the most cost-effective long-term strategy for, combating or just taking care of cancer altogether. So 33% of cancer diagnoses are caused by tobacco use. So let me put that one out. So meaning that if you cut down on smoking, you are going to be reducing cancer diagnosis with a larger percent. 20% of cancer diagnoses are related to individuals being obese and overweight. So the more you work on yourself and your weight and fats, the better it is, and the lesser you have issues with your with any form of cancer. 16% of cancer diagnoses are related to infections with one of several cancer-causing pathogens. 5% of cancer diagnoses, they are related to individuals getting insufficient physical exercise. So staying active is important, not just going to the gym alone. Instead of using the elevator every time, maybe you should climb the staircase. Instead of driving every time, sometimes take a walk, brisk walking, jogging around your environment, just staying active, because sedentary lifestyle can also affect your heart, can affect different conditions as well. So 5% of cancer diagnoses related to individuals with poor dietary habits. If you don't eat well, you just eat just the way you like, it can also increase your chance. 2% of cancer diagnoses, they are a result of exposure to ultraviolet light from the sun or tiny, devices. So the good thing about some type of cancer, I mentioned earlier, they can be prevented. So vaccine can prevent some type of cancer. Yes, I mentioned HPV, which is human papilloma virus, vaccine. There's a vaccine for it, different type, Civarex, Gardasil, they can all decrease your chance of getting, cervical cancer. And hepatitis B vaccine can also prevent hepatitis B virus, which can prevent it from having a chronic version of it, because we have acute and chronic version of hepatitis B, preventing liver cancer altogether. So it's important to note that these both vaccines, they are a 3-dose vaccine. Usually hepatitis B is 2 doses, then 1 booster dose. it's important to take it. Even adults, we have adults as well. So you take it at birth, but as an grown adult, get tested first to know your hepatitis B status, then you can get, vaccinated. So while I talk about prevention, promoting protective behaviors is important. Complete your dose, eat healthy, get enough physical exercise, quit smoking. It's not a walk in the park. Again, you can start desensitizing yourself gradually. Join a program that helps you, quit down all of these excesses, right? Because sometimes we run to substances to solve a problem in one season, and in a different season, these substances become a problem. They're no longer serving the purpose that they were. So it's good to always have healthy coping mechanism. Are you stressed? Talk to someone, communicate, relate to people. Yes, just that's a few ways you can manage stress. Avoid what you can avoid, right? Alter the stressor. So maybe you need to change the way you communicate. Maybe you need to change your appetite. Maybe you need to work on the budgeting. At some point, learn to adapt and accept the things that you can change. So avoiding exposure to certain chemicals, limiting exposure to radiation. So when you go for the hospital, you take someone to the hospital for a check, X-ray, or any exposure to radiation. It's important to stay outside and not get exposed, except it's for diagnostic purpose. I've talked about exercise. I've talked about maintaining weight. Getting enough sleep is important. It's like you're shutting down and, of course, re-energizing yourself in the morning. Seek appropriate medical care. So if you are suffering from any medical conditions, chronic conditions like diabetes, ensure that you take the preventive measures. Get tested for hepatitis B and C, screen for and manage obesity, and screen for different types of cancer. So what is our role today? Is to educate people on how cancer can affect our community and give people tips on how to lower their cancer risk. If you have gained one or two today, it's advisable to pass it forward. Work with other groups, community, whatever NGO, whatever things you're passionate about. Ensure that you educate them as well, and of course become known as a community leader in the fight against cancer. Thank you very much. So I'll just take questions.
Fantastic. That's huge. That's well loaded, well packaged, precise, straight to the point, easy to remember, easy to work with. Thank you so much, Dr. Precious. That was a precious talk there.
Yeah, of course. Thank you.
Also. All right, guys, you have a question, please you can unmute yourself or send the question to the chat room and I'll help you read the question. But please don't, people are chatting directly. Ask the question, be bold to ask. Someone asking me that what can a man do to help a woman to prevent breast cancer? How does that concern me? Ask doctor, don't ask me.
Yeah, that's a good question though. I can answer that. That's a good question.
They want to suck something. I don't know what's wrong with them.
No. The thing is that sucking a woman's breast, your wife's breast, it doesn't prevent breast cancer, right? However, when that action is taking place, as a man, because you know what you know now, you can also observe for any structural changes. So now you are making your wife happy, you guys are on it, and maybe you detect a lump or a growth. It's okay to say, honey, while we were at it, I just realized that I felt something. So you can also be a second eye when it comes to early detection of any lumps. I hope that makes sense.
Fantastic. One thing is cancer, hereditary. I mean, can it be passed down from family?
Yeah. Some types of cancer can be hereditary. Basically, all conditions have genetic tendencies. So it's like your gene is passed on from your mother, your parents to you. Some type of cancer can be, like for example, some type of breast cancer can, the gene can be passed on to the next generation. Prostate cancer, if it runs in the family, chances, it's not automatic. So when we use the word risk factors, we are saying that the chances of having it, these are the chances of having it, but it's not automatic, right? So it's also very important to know that the fact that one person had it in the family doesn't mean everyone will have it. So some type of cancer can be hereditary. Yeah.
Madam Adekoju, you have a question. Unmute yourself, man. Ask a question, Adekoju.
All right. Good morning, everybody.
Yes, ma'am.
Thank you so much, sir, for the precious delivery.
Yeah, you're welcome.
That was awesome. Briefly, I have two questions here.
Yeah.
Number one, talking about the HPV.
Yes.
I was opportune to be under a lecture at the same time I went for cervical, examination, and they mentioned that we can take the HPV for our teenage girls.
Yes.
They actually explained that it comes in 3 doses, if I'm not mistaken.
Yes.
And the person planned to give us how to do it for the teenager. Unfortunately, I couldn't get the direction. So I don't know if you can help out to get a clinic that can do that so that we can do that for our teenage girls. That is number one. Then number two, talking about mammogram. I've been doing it before now, but I want to know, is it risky to do it often? Then how often should one do it? Mammogram.
Okay, all right.
Yeah.
All right. Thank you very much. So in answer to your first question, ideally, HPV vaccine should be taken before the period starts, before menarche, right? Around 9, 11, early teens, that's the idea. That's when you should take it. So yes, it's okay that your teenage girls are taking it but as an adult in your 20s, 25, 20s and 30s, you can still take it from 21, but you need to get tested, get a pap smear done before you take the vaccine. So talking about the clinic, there are different clinics. I may not be able to give you one specific clinic now, but maybe I can get it in touch through the REM, the retention manager, to you guys on that. For your next second question, mammogram, again, exposure to X-ray can also increase your risk of developing, any changes in the structure of the breast. So mammogram is relegated for women from 40 years and above. So until you're 40, you shouldn't be doing a mammogram. It's done. Get a mammogram unless it's been ordered by a doctor just for diagnostic purpose. So it's once every year. So once every year is fine. So from 40 years and above, once every year. So that's the recommended. I hope that makes sense.
Someone's asking the question also, can someone with hepatitis B be taken to prevent in transmission to others?
Okay, what can hepatitis B be taken to prevent transmitting to others? Basically, for you to see, once you have hepatitis B, you can't cure hepatitis B. You have the person have it, the person has it, right? To prevent transmission to others is that basically the other people needs to be vaccinated. The other people need to be vaccinated. So the prevention is vaccine. So once the person has it, the other person can, if he's vaccinated, usually you are protected from 30 years to life. So it's important to get vaccinated. So vaccine is the number one preventive measures for hepatitis B. So you take care of yourself, someone who has it, eat well. Usually you don't have any specific treatment unless you're having severe chronic stage of it where you're taking antiviral medications and all of those, medications prescribed. However, every other person needs to get vaccinated. That's a way to prevent hepatitis B.
Okay, so someone's asking again, can exposure to fumigant aid to liver cancer?
No, it cannot. Fumigant, that's what he's trying to say. It doesn't. Yeah, it doesn't. It doesn't. Yeah.
Someone say he missed that monogram part. What is monogram? And for ladies above below 40, what type of test should be taken?
Okay, so mammogram is the X-ray of the breast. So because we're trying to prevent breast cancer or detect breast cancer on time, right? So mammogram is the picture to see if there are lumps in the breast. It's relegated from women above 40 years and above, right? So for women below 40 years, what you do is breast self-examination. I mentioned that earlier. 2 things you do. You inspect, you look with your eyes, observe, and the second is palpation. So inspection and palpation. You start the test 3 to 5 days after your period ends. 3 to 5 days after your period ends. I'll say that again. And inspection is looking in front of a standing mirror with your shirt off. You're looking at the structure of your breast, your both hands on your side. And of course, the next is to look at, is it retracted nipple? Are you seeing structural changes? Do you have an orange pea back coloration on the breast? The back of an orange. those tiny, tiny holes. If you're having that structure, we'll call it poderage. If you're having those structure, that can be a sign that something is wrong. So you're looking at it structurally. Anything that is unusual, one is overly bigger than the other. Or then the next is palpation. So you lay on the flat surface, maybe with a flat towel underneath the shoulder of the breast you want to examine. So let's say you want to examine the left breast. So the towel should be under the left shoulder, right? With your left hand at the back of your head. So with your right hand, you examine you compress, you press, you massage basically all 4 quadrants just to check for any presence of lump. So, and you check all the way to the armpit if there's an inflamed lymph nodes. So you do that, that's breast self-examination. If you do that every month, for every changes you report to your doctor, the prognosis is usually very, very good. So I hope that makes sense.
Fantastic, guys. This is something that we can't joke with. Let's take precaution. Early detection is very important. You can even prevent it by knowing these things. Let's put action to what you're learning. So I'll ask a question: at what stage is cancer irreversible?
So basically, when you say irreversible, I think you're trying to say that you cannot cure the cancer. Again, I want to say this. Most cancers, from stage 1, we have 4 stages, right? Okay, let's just say 0, 1, 2, 3, 4 stages. So, and the stage 1 and 2, the cancerous cells, 0, 1, and 2, the cancerous cells, they are confined to the location. So if it's a breast cancer, it's within the breast in stage 1 and 2. So it's easier to manage at that point in time, because now it's either you are removing it, the cancerous cells, and following up with chemotherapy, or you're using radiation therapy. So the prognosis is better. So at least more than 50% better. When I say prognosis, I mean outcome. So, however, in stage 3 and 4, the cancerous cells, they move from the breast to the spine, sometimes to the lungs, sometimes to the stomach. Anyway, it's like they're just moving through the blood to anywhere they can rest and start growing again. So from stage 3 and 4, it's more deadly, and because now you have to use more aggressive form of treatment. So that's why early detection again is very important. So it's not at any stage, cancer is deadly. However, in stage 3 and 4, it's most deadly because at that point in time, it has spread to other parts of the body, and the prognosis is not usually very good. I hope I answered
Fantastic.
that.
Thank you. Yes, thank you, sir. So another question says, which age can someone be vaccinated? From what age can someone be vaccinated?
Okay, what age? Again, the day they give birth to you, there are vaccines that you'll be given. Hepatitis B vaccine, some vaccines you'll be giving at birth. And a few months after birth, your measles vaccine at 12 months, hepatitis A. There are different types of vaccine. What's it called? The different types of diphtheria vaccine, pertussis vaccine. So at birth, there are vaccines you'll be given, right? First 1 year, basically. But there are also adult vaccine of those. So anytime, as long as you are an adult from 18 years and above, you can take some vaccines. Like hepatitis B vaccine has adult dose. So instead of taking 0.5 ml, maybe you can take 1 ml. So make sure you get vaccinated properly by medical practitioner, and of course get tested before you get vaccinated. Yeah.
I have one hidden question here. It's sent to me directly. That's a very funny question, direct question. I will read it out.
No
Okay,
problem.
so there's a myth that a man needs 21 ejaculation every month to prevent
prostate cancer. Yeah, I was expecting that question. So let me say this. Again, the prostate gland, it secretes semen that helps, that propels basically the sperm during ejaculation. And again, naturally, it increases in size as you age, right? But most persons don't have symptoms for life. They're just okay and they live their life. However, some persons get to have symptoms. So yes, there's a study that was done in the US where the chances of people who ejaculate more were less than people who do not. So if you're ejaculating more, I think about 20% or so, there were less chances of developing prostate cancer compared to those who do not ejaculate. And when I say ejaculation, it's not just about sex. You can actually ejaculate without sex. So my point is, the study has been done. However, we don't have enough data to make it complete recommendation. All right. It just plays a part. So I can't just go about and tell you, you know what, when you ejaculate 21 times in a month, you're going to prevent yourself from having prostate cancer. No, we can't just say that, because don't forget, there are other risk factors. So you are ejaculating, but you are smoking. You're having sex, you are smoking, you are drinking alcohol. Yes, there's a family history. So you're going to you're calling the prostate cancer on time, irrespective of how much you get to ejaculate in a month. So it is not a rule of law. It is just it may be a recommendation, but we don't have enough data to say, oh, this is how it works. So it's an ongoing study until we get enough, maybe in this part of the world. So we can now say that it decreases your chances of having prostate cancer. So I hope I explained something. I'm just trying to make.
Thank you so much, Doctor. That's fantastic. Any more questions, guys? Please stop sending me individual questions. Put it in the chat room. What is in the question? To be as if I'm the one asking questions. All right. So please put in the chat room any question. You have less than 4 minutes to round up this section. All right. If you came late, don't worry. We'll send a replay to the group immediately after this class. After this live section. And please also don't forget, by 11 a.m. we are in the office to do health, some vital checkups. So please be in the office from 11 o'clock this morning. Come to the office after the health checkup. Of course, there will be a lot of refreshment, music, party activities going on today in the office. I'm sure our office director will enforce that. So before we go, let me give room to one of the members of the welfare department. After I'll call on the welfare director to give a closing remarks. Madam Malara, please unmute yourself. Give us some remarks. How was today's section, and what's your advice to our ladies and everybody here?
Good morning, everyone. Thank you, Pastor Bobby, for anchoring this thing so well. And thank you, Dr. Precious and your IGR team, for coming to educate us this morning concerning our health, the things we can do to prevent cancers in the various types of cancer. And it was a very, very informative and enlightening session. And I want to encourage everyone, let's adhere to all the instructions that have been given. Eat right, exercise, no smoking, no drinking excessively, just live right, so to speak, especially concerning our diet. We need to watch that too. And I believe if we put that, all that to use, God helping us, we will live a very, very healthy life so that we can do our business. When there's sickness, when there's illness, we can't do this business well. And we need to be healthy to do this business well. So let's just, as Pastor Bobby said in the replay, we can go over it and listen and even educate those around us, and also talk to people around us that we see are living careless lives, and things will turn out well. Thank you, everyone, for coming. Thank you. God bless you. We're expecting you in the office. We're already here getting set to receive everyone. It's still the 6th anniversary celebration. So see you soon. Thank you. God bless you.
Thank you so much, Madam. I'm the executive at the welfare department. Madam Benita, are you there? Please remember that your voice is not active. Can you just activate your voice by dialing in or log out and log in again, preferably. All right. So, and I have also in the call, on the call, Basha Suyi, any remarks to our members after this section? From the male perspective, are you not in court? Basha Suyi, are you there, sir? Any remarks on the male perspective? I think it's busy. Bryce Adda, good morning, man. That's our company secretary and director in REMS. Can you speak, man, Bryce Adda? Any remarks for our members? And any word for our doctor? Are you guys in a good place to speak? Are you back on the call? Are you back? She went out. Let me see if she's back. So I can just close out this section. officially. Where are my organs? Oh, let's see. Let me just try and give a call to Manabenta to give us go ahead to end this section. If you have any questions, you can send up a question at the chat room. You're free to talk. Please don't forget, be at the office this morning. We're having a health screening. All right, so Manamenta is back on the call. Manamenta, our director for welfare department, is on the call. The director in REMS and also the one under the welfare REMS. I'll meet yourself, man. Give us a closing remarks and a final note.
Thank you very much, Pastor Bobby. Dr. Precious, thank you for delivering a precious teaching for us today.
Yeah, thanks everyone.
Thank you so much. We appreciate you. I've learned one or two. At least this is the first time I'm hearing that men can even have breast cancer. At least even if it's 1%, it's the first time I'm hearing that. Thank you very much for all the precautions. I'm sure a lot of people here have learned one or two. God bless you so much. We appreciate you.
All right. So what I would do, I will send the slide across through the retention manager. I think
Okay.
I'll do that for us. You can have the slide for reference purpose, so everyone can get it.
Oh, that's very good. Thank you very much. We appreciate that.
All right.
Okay.
So after that activity, how far to that activity? So what's going to happen today, man?
Yeah, okay. By 11 o'clock, we are having the vitals check. And after them, we're having prayers and dance. So office will be busy. I'm driving, actually. That's why I've been having breaking in connection. I'm going to the office right now. So we're expecting our members.
Don't forget the refreshment too. You didn't say that one. Let me say the refreshments. You will not dance in vain. Your belly will, your mouth will dance too. Okay, REMS Nation.
I didn't hear you, but I think you said you prayed. Amen. Network is breaking from my end.
There'll be refreshment for everybody that comes. Your mouth will dance also. She didn't get that. That's fine. All right, so guys, thank you so much for joining on this call. If you join late, don't worry. We'll send the replay to the group like ASAP. Thank everyone for being here. Madam Sonia, Pastor Suye, Pastor Ada, all the leaders in REMS. Thank you so much for being
here. Yes, surely.
That's confirmation. So from director anyway, it's here. Food they flow. Now anointing with that. All right, guys. Thank you, Dr. Precious. Thank you, Ife D. Ife D is our relationship manager for my
sir.
Yeah, thank you for everything you're doing. Please, as I said, let me say it openly. Ife, we need to help us, our people, prompt service, prompt attention, guide us well, please. All right, to get the best service, for Nigeria. Thank you, everyone.
No problem, sir.
All right, have a nice day, everyone.
Yeah, have a good day. Bye for now, everyone. See you in the office the next 1 hour. Bye, guys. See ya.